Well, thank you. We are about 5 minutes behind, and so we want to get ourselves started. Once again, for those of you just joining us, my name is Cecil Corbin-Mark, and I'm the Deputy Director at We Act for Environmental Justice. I want to thank you all so much for coming on back. I hope you enjoyed and were inspired by the resource sessions that you had earlier. This afternoon, we are so honored to have a panel discussion that will be moderated by our esteemed Borough President, Gail Brewer, and also participating on that panel will be our extraordinary public advocate, Letitia James, and we are going to also hear from Dan Kass, a longtime friend of WEACS and a longtime friend of many environmental justice organizations across the city, and Dan's from the Department of Health and Mental Hygiene. And unfortunately, Mr. Cecil House wasn't able to be here today, but we do have a Mr. Luis, and I got to look at my, Luis Ponce, who is his Vice President of Operations at NYCHA. I know NYCHA came up a number of times in our conversation, particularly in light of our panel. So this will be a real time for us to have an opportunity to engage with folks from NYCHA. And Mara Blitzer is also going to be here from the U.S. Department of Housing and Urban Development. So I just want to take 2 seconds to call up the Borough President, and in the process of doing so, I just want to share with you, it's been my distinct pleasure, our distinct pleasure as an organization, to work with Gail Brewer. She is, one of those individuals, Peggy and I would sometimes joke, Gail introduced technology to a bunch of people before technology was hip. She was the one emailing before email was really hip. But Gail Brewer is the 27th Manhattan Borough President, responsible for advising the mayor and the city council on borough concerns, commenting on all land use issue matters throughout the borough, advocating for the borough in the municipal budget process, and appointing members of Manhattan's 12 community boards. Ms. Brewer previously served on the city council for 12 years and has an MPA from Harvard's Kennedy School of Government, and she did her undergraduate work at Columbia University and Bennington College. I want to ask you to warmly welcome to the stage Manhattan Borough President Gail Brewer.
Thank you very much. I'm a huge fan of WEAC and Cecil and Peggy, but I want you to know I had the first BlackBerry at City Hall before Bloomberg. Nah. I was very proud of that. So I am very honored to be here today, and I assume, Cecil, we should ask the panelists to start to come up. So why doesn't the panel come on up, and I'll just give a little bit of introduction. Obviously, we're going to be talking, and I know you've done this already during this amazing conference, to think of ways of targeting and correcting and preventing challenging indoor environmental conditions that lead to dangerous health problems, asthma being the one that we and you have focused on over the years. And I think that there's so many, it is frustrating to me to think that we can go to the moon and we can figure out ways of dealing with technology, as Cecil indicated, and not figure out how to deal with how to make buildings more energy efficient, non-mold, and prevent chronic illness that some of these building materials, particularly in NYCHA, but in private buildings too, make unsafe for so many New Yorkers. WEAC is really special. Just this week, not to talk about asthma and poor housing conditions, but some of us toured the new bus depot named after Mother Hale, who many of us knew. And this is an amazing WEAC, and others, but mainly WEAC success with a completely healthy bus depot. It's a new building. It's manufactured. The buses are going to be healthy. It's an example of what one organization can do. And, of course, they've been tackling the issues that you're talking about for many, many years. It says here 3.5 decades, but I have to say I've known Peggy that long. Oh, my God. So it's probably even longer. I think you know about the asthma rates. I'm sure you've been talking about them. Much higher in East Harlem, much higher in Harlem than on the Upper East Side. And the issue, of course, is, which always has been challenging to me, that hospitalizations, for asthma in northern Manhattan are 2 to 3 times higher than the New York City average and 4 to 5 times higher than the national average. Low-income New York City children are up to 15 times more likely to be hospitalized for asthma than their wealthier counterparts, and we all know that includes missing school. And that's, in Manhattan in particular, we're all very close to large academic medical centers. So to have this number and to be so close is something very challenging about how we provide health care, but also the fact that we have so many challenging situations in our homes. This is so preventable. We talk about mold, we talk about soot, we talk about auto exhaust, we talk about pests like cockroaches and mice. Some of you know I was a bed bug queen of New York, but bed bugs, they're horrible. They give you mental health, but they don't give you any other physical challenges. And of course, we all have the issue of a higher percentage of pollen. We know the challenges that roaches and mice produce in terms of allergies and asthma and all the allergens that go with them. In the Census Bureau, 2001, public housing apartments had 4 times as many roach infestations and 3 times as many leaks as private rental apartments. I passed a bill in the City Council with public advocate support and others to try to make sure that the leaks are addressed, and to the credit of the City Council, they're going even further as we speak today. It is outrageous that leaks are not addressed because they produce a huge amount of the issues that we're talking about today. We also have an issue of pollen because there are unkept vacant lots and spaces that have spore-spewing weeds like ragweed, and these are issues that produce more pollen when exposed to the high rates of carbon dioxide found in our cities. So we're very excited about hearing from our panel today. We know that housing regulations can be helpful if they are passed correctly, monitored correctly, and funded correctly. And we know that we need peer-based community programs. We need community medical providers that use state-of-the-art asthma care practices. We need the issues between schools and parents and figuring out how to make sure that medical providers are part of that equation. I think we need something that's energy efficient in terms of some of their solutions. And we need all of the above, unfortunately, in order to address these questions. And that's what our panel is going to discuss today. So each panelist will have 5 minutes to talk, and then we will have questions from the audience. So, Madam Public Advocate, would you like to begin? We would like to have you begin, and then we'll introduce each member of the panel as we go down. But we thank the panelists for being there, taking time from their busy schedules, and we look forward to their very important discussion. Thank you so much all for being here today, and thank you, WEAC, for decades and decades of service. Thank you.
Thank you. I want to thank WEAC and Cecil and Peggy and, of course, our amazing Manhattan Borough President, Gail Brewer. Let's give her another round of applause.
Thank you. 5 minutes, ma'am.
Okay, so I've got to give you some credit. So the Borough President and I, when we were in the City Council, we both defended then Transportation Commissioner Sadiq Khan. We stood up consistently in support of bike lanes and city bike and pedestrian plazas and the greening of our city. It was really critically important, particularly in a concrete jungle known as New York City. And so I'm deeply humbled to be here this afternoon. I'm deeply concerned about the health and safety of our current housing stock, and perhaps most importantly, making sure that current and future construction conforms to the most progressive health and safety standards of the day. In the City Council, when I first entered the City Council way back in 2003, was responsible for creating an asthma initiative, primarily because I represented Fort Greene, and Fort Greene and the Bronx lead in terms of asthma rates in the city. I'm happy to report that those asthma rates have been greatly reduced as a result of that initiative, but we should continue to fund that initiative. And as a ex officio member of the City Council, the reason why I hang around the City Council is to make sure that all of my initiatives continue to remain funded. As most of you know, last month I released the Worst Landlords List. It is a tool that I believe will help us weed out the bad and irresponsible actors in our city. The fact is, we have some really horrible landlords in our city that allow their buildings to fall into disrepair. Mold, rats, roaches, peeling lead paint, broken pipes, backed up sewage, and more. And who suffers? It's primarily New Yorkers, primarily seniors, primarily individuals with disabilities, children, individuals with medical conditions. And most of these tenants don't have the means to leave their homes or seek legal recourse. And let me talk a little bit about legal recourse. All of us have got to work together to talk about the environment of housing court. The environment of housing court is really not conducive to tenants, particularly when most of the parts, the courtrooms, are dedicated to landlords and not to tenants. And so all of us need to work together to ensure that there's more parity and equity in landlord and tenant court. Many of those who are on my worst landlord list are repeat offenders who have buildings in some of our poorest neighborhoods. And let me just add that some of these neighborhoods, as most of you know, are rapidly gentrifying neighborhoods. Brownsville, East Harlem, Morris Heights, and others. We now have over 6,700 buildings on our list and over 5,000 landlords in a searchable database. I must say, when I released the list, I've received a number of calls from these wonderful people who threatened me, who threatened me. And as you know, I'm not afraid to take on challenges, and I told them to bring it on. Truth is an absolute defense in the law. And so if I was wrong, prove me wrong. And it's clear that the bad landlords and mismanaged buildings exist disproportionately in low-income neighborhoods, and as I mentioned earlier, in gentrifying neighborhoods. And I will continue to use the Office of Public Advocate. I've sort of changed and transformed the Office of Public Advocate. We, as I promised you during the campaign, I have lawyered up. And so we have a legal unit, and the legal responsibilities of the office. I've basically challenged the officers to challenge landlords and managers who believe they can disregard laws and the safety and health of the tenants for their own financial benefit. We primarily work on patent and practice cases and impact cases in the Office of Public Advocate. My office currently right now is in court. We're suing a landlord in the Bronx. I'm sure you've heard of him, Goldfarb Properties, and we're suing him in federal court. We are also suing a number of landlords, both in Brooklyn. We joined with residents in Brooklyn, where we got a judgment against an assisted living center in Prospect Park West, where they wanted to evict senior citizens who were at the end of enjoying the last years of their life. And so next year, I want to see fewer buildings on this list, and I'm sure I do not want to see the same names, or else we'll be taking them to court. You all saw on the front page of the Daily News the number one worst landlord in the city lives in a multi-million-dollar mansion in Westchester, has a number of homes in the Bronx, and each of the buildings on average have over 100 violations or more. There's something really unconscionable and something that all of it should offend all of you, and we really want to raise the consciousness not only of these landlords but of all New Yorkers in the city. We also must focus on future construction and make sure that we build green, and that we employ individuals in the green construction area, particularly those who are historically unemployed and are underemployed and unemployed. It's critically important that we work with our labor unions so that our apprentice programs teach the next generation of construction workers the latest in green technology. And in fact, I am working with the construction trades as we work with the de Blasio administration in regards to building the 80,000 units of affordable housing, as well as sustaining 120,000 units of affordable housing. Soon we'll be announcing an apprentice program focusing on green construction. It means working with architects and developers so that they can build green buildings that will reduce their carbon emissions and the carbon footprint. We know that we need to reduce our fossil fuel consumption, and we know that our heating and cooling systems need to be airtight so that mold, a silent killer, doesn't develop behind walls. We also know that Hurricane Sandy exposed so many flaws in our housing stock, and we must use this opportunity to retrofit and build better and smarter along our coast. I'm grateful to all of you today, but let me just also say that I hope that all of you join me and others in the City Council, including Councilmember Lander, Councilmember Richards, and Councilmember Chin, and urge your council members to pass the bill that would set a 10-cent fee on those single-use plastic bags in our city. It's not a hidden tax. Don't believe that. It's really about changing culture. and it's really about protecting our environment. And so I would hope that you would join us and not be bullied by those who think it is a racist tax. It is not, and it has nothing to do with race. It has to do, again, with changing the behavior and culture of individuals and protecting our environment. And so with that, I know, am I?
Perfect.
I'm perfect? Okay, thank you so much.
Thank you, Madam Public Advocate. Our next speaker is Deputy Commissioner Dan Kass in our Department of Health, and I want to echo Cecil's comments about how helpful he has been. This gentleman, for those of you who don't know him, has solved hundreds, if not thousands, of public health challenges over the years, quietly, efficiently, with dignity and responsiveness to the people whom he's working with. I know that firsthand. Dan Kass.
Well, thank you. I feel I live with a 15-year-old daughter, and I can just say that's about the nicest thing I've heard in a really long time. So thank you. So I just want to say a few things. So it's really nice to see a lot of new and old faces here. You know, there are many of us at this summit who've been working on the question of housing quality for a really long time, and I think it's fair to say that we've made tremendous strides, but there's an enormous amount of work to continue to do. You know, if we follow up and just take the example of asthma as one health outcome associated with poor housing, you know, we have made significant strides, as the public advocate has indicated, in terms of trying to reduce the frequency with which children, especially in low-income neighborhoods in New York City, are appearing in emergency rooms or for emergent care or in hospitals overnight for asthma. But the truth is the disparity between low and high-income neighborhoods continues to be really unconscionable. And as much progress as we've made in the medical care or the healthcare establishment in getting primary care and putting kids on controller medications, on raising awareness within families of how to manage asthma effectively as a chronic disease, there have been tremendous strides. But probably the single most important area which has been so intractable and really has not shifted is the difference in the quality of the environment that people live in. You know, we have, and I think it's also fair to say, both from a scientific perspective and from a practical one, that the most important environmental condition that really helps to explain this continuing disparity is what happens indoors more than what happens outdoors. So, you know, I know you've been talking for a day already about these issues. I don't need to go over what contributes to that kind of disparity, but I did want to just share a couple of ideas that we have at the health department and some work that's happening within the city to try to make some inroads. I think many of you know that there's been a tremendous amount of education that's gone on over the last decade, both sort of out of government, but more importantly within communities around the role that the indoor environment plays, pests probably being the most significant explainer of the disparity in asthma outcomes. If not the actual prevalence of asthma, the difference between neighborhoods, but also mold and certainly secondhand smoke matter a great deal for a lot of kids as well, and for adults. There has been a tremendous amount of education that's gone on. On the policy front, it's been quite a bit trickier. I want to acknowledge that one of the immutable numbers out there that we track has to do with the number of housing units across New York City with housing maintenance deficiencies. There's a great survey, for those of you who don't know, that's done every 3 years out of HPD with the Census Department called the Housing and Vacancy Survey. We've been tracking questions about pests on there for a better part of a decade now, as well as general indicators of housing quality. And we had been hoping as a health department, and if you look actually at our Take Care New York plan from a few years back, we had been hoping to really make inroads into the disparity between low and high-income neighborhoods around that question of housing quality, and it hasn't moved. The needle has barely budged. There continues to be, many-fold differences in the proportion of apartments that have, say 3 or more housing deficiencies, like leaks or pests or cracks or inadequate heat. So what do we do about this? There are limits, obviously, to the enforcement model. The city's been enforcing good quality code for a very long time, and I don't mean to step back from the importance of enforcement. But there have to be other things as well. The reality of the marketplace for, let's say, pests, for example, is that the savings that landlords experience from doing inadequate maintenance or inadequate pest control are basically costs that are magnified enormously on the healthcare system. So so the question really is sort of where it would be obviously far more fair for property owners to bear the burden. It's their responsibility. But practically speaking, they don't consistently do that. And I know there are a lot of people in the room who are struggling mightily to hold their feet to the fire to do that. But one of the things that we're really trying to work on is we're trying to make the case, as other areas have around the country, that the medical care establishment would stand to benefit enormously by paying for good quality pest control or other indoor allergen interventions in housing. So I'm happy to, sort of say that we've started. We have a really wonderful grant from the Robin Hood Foundation and the New York State Health Foundation to basically test and calculate the actual savings to the healthcare system from doing very, very simple, very high quality, one-time intervention pest control. We're doing it right now in the Bronx. We've recruited about half of our studies. And the idea here basically is that with the advent of Medicaid Reinform, with the Affordable Care Act, there are a brand new set of incentives on healthcare payers to reduce the number of ED and hospital visits. So it's the right time for this, and we're confident that in about a year and a half, we're going to be able to demonstrate that paying $600 for high-quality pest control that lasts a year and removing antigens from homes will more than pay for itself in savings across a pool of the insured, especially low-income insured. So that's something that we're really excited about, and I think that while I don't think it's necessarily a paradigm shift because people have been thinking a lot about how to leverage resources for housing quality improvement, we think that now is a great time in New York State to really make this case. So that's one thing that I want to say we're working on. The other thing is, we at the health department have modest enforcement resources in these kinds of areas, but we're really trying to think about how to leverage them better. We've seen an incredible precipitous decline in the number of children with lead poisoning in New York City, and we have resources within the health department of a staff who have been dedicated to that. And so we're really trying to think about how to use some of essentially the excess capacity, if you will, that we have to really promote healthy homes work. So there are a few things that we're really excited about. One is that we're piloting a new enforcement model where we're taking referrals from healthcare providers whose children or whose pediatric patients have persistent asthma and who self-report pests. So that's a tricky intervention. We're trying to get physicians to ask a question about their housing quality, and that's, for those of you who work in the healthcare field, that's not an easy thing to do. So we're trying to do that. We've also just begun an opportunity with our immunization registry where physicians can actually check off a box on the when they're reporting immunizations about whether a family has agreed to a referral for an inspection for pests. So where that happens, we're going to go out, and where we find pests, we're ordering landlords to abide by our health code, which arguably has some of the most progressive language around promoting safer pest control that we know of anyway. Difficult to enforce, difficult to get followed, but at least for a significant, or for a set of people who stand to benefit the most from these kinds of services, we hope to make inroads in this area. I want to also say that we've had some innovative partnerships, I think, with HPD. HPD, for those of you who aren't from New York City, is the Housing Preservation Department that basically does housing enforcement in multi-unit dwellings. And we have been jointly issuing orders to property owners around bed bugs, and we hope to do so.
We love Vito. Everybody loves Vito.
We love Vito
The whole world
Mostachulo.
loves
And for
Vito.
those of you who, there's never been, in my experience, a more dedicated and innovative public servant around the needs of low-income New Yorkers living in less than decent housing. So we're working together on trying to leverage the strength of the two agencies. HPD has incredible resources and workforce around enforcement. We have a little bit of authority through our own Board of Health. And so we're trying to do things jointly, essentially scare landlords into complying not just with the housing code, but also with the health code that can be far more prescriptive about what they have to do to remedy a problem, whether it's bed bugs or cockroaches or mice or rats. So that's an area. And then I think, with the limited time I have, I just want to also say that one of the roles we have as a city, certainly as a health department, is to do our best to inform people about not only the extent of the problem, but whether progress is being made. And so I really want to encourage people to use a resource we have, which is called the Environmental Health Tracking Portal. If you go to nyc.gov housing.gov/health/tracking. There's a lot of housing quality information. You can map your neighborhoods. You can create neighborhood quality reports on housing, look at associated health outcome indicators, and get a sense of what, at least how we perceive the relationship between housing quality and health. So I'm going to sort of pause there, and thanks very much.
Thank you very, very much. Next, we're delighted to hear from Luis Ponce, who's Vice President for Operations and Support Services at NYCHA. And I know we talk about NYCHA a lot. They have tons of challenges. I know we're very supportive of the residents and the resident leaders who have one of the hardest jobs in America. They run small cities, and so does the general manager of each development, and certainly NYCHA. So with limited funding, they do what they can, but they have a lot of challenges. So we look forward to hearing from you. Thank you so much.
Thank you. I have a long speech. It's probably going to be longer than 5 minutes, so I'm just going to skim through it because I see there's probably going to be a lot of questions for the Housing Authority. For the people who are, thank you for the opportunity to speak here today. I just wanted to give people this the scale of the Housing Authority in New York City. So we're the largest housing authority in North America. We have over 178,000 apartments in 334 developments, and we also have 91,000 Section 8 vouchers that we administer, housing approximately 600,000 New Yorkers. I'm going to go over a few efforts that we have, and I think they're in line with what we're talking about. One of the efforts that we have as far as energy efficiency, we've worked with Consolidated Edison, also with HUD, on putting together about $18 million in energy performance contracts. They have allowed us to get energy efficient lighting retrofits using LED and more efficient lighting at 17 developments and heating plant upgrades at 6 developments. We're also working with HUD to get a longer term environmental performance contract to kind of duplicate these efforts throughout the authority. At one of our developments in Manhattan, 344 East 28th Street, we've actually installed a geothermal system to get heat from deep underground to help preheat the water at the development. That's also saving us to use fuel, to use steam to heat the water, allowing us to, again, to reduce our carbon footprint. We have one of our largest developments in the Bronx. It's Castle Hill Houses. They've undergone a large-scale energy efficiency improvement there. We've replaced all the boilers there with what we call 4-pass boilers, which are about 90% efficiency compared to about 80% that we have in our other buildings. We've also changed the lighting in the apartments and also in the public spaces there. And we're using a kind of a newer technology, is wireless energy modules, where we're able to read the apartment temperature and also the energy usage in the apartment. So we're using that for 2 reasons. So we can it can automatically change the boiler so we won't overheat the apartments, again, saving energy. And also we can actually read the energy usage. So we're working with residents who have high energy usage, try to encourage for them to be more efficient and to really identify what other efforts we need based on what we're finding in those apartments. We're partnering with Green City Force. We have a door-to-door energy education and lighting upgrade campaign. Green City Force is young NYCHA residents who they provided tips. We provide actually the complex fluorescent light bulbs to our residents, and we provide energy saving tips, again, to encourage energy savings at the Housing Authority. In the middle of about 2005, we started using a computerized heating management system. This involves certain alarms, and we can control our boilers remotely to a certain extent. What the effort of this is to identify where there's failures. So oftentimes we can respond to failures before the residents even know that the boilers are down, to avoid residents using less efficient and sometimes dangerous ways to heat their apartments, either electric heaters or sometimes using the stove for heating. So we're working on that also. We've installed instantaneous hot water heaters at about 800 of our developments. These instantaneous hot water heaters work with a lower steam pressure, again, to use less energy. And they also don't require us to heat large amounts of water to be stored at times when residents are not using them. Some other initiatives that we've done with this is, we've increased our use of electric vehicles and compressed natural gas vehicles. And we have instituted a few green roofs at some of our developments. We're working with our community programs we have a Healthy Homes Initiative. We're working with chronic disease prevention, educating residents to improve educating residents and allowing them to have more access to healthy foods, encourage physical activity, and community-based preventive health programs. We're also working to reduce smoke, secondhand smoke. We're educating them on the dangers of secondhand smoke. We are putting them in touch with resources that provide smoke cessation programs to try to reduce people who want to quit smoking. We're also enforcing at our housing developments, you're not allowed to smoke in the public areas. We're also trying to enforce that to reduce on people being exposed to secondhand smoke from other residents or visitors. And on that note, we also have about 23 health clinics in our developments, and we have 12 naturally occurring retirement community-based social service programs at NYCHA. Again, we work with resident association presidents or leaders. We bring these resources. We actually reach out through nonprofits and other city agencies to have presentations to our residents to encourage these programs for healthier living, how to enroll in affordable health insurance, and expand the quality of preventive health care. The mold efforts in the Housing Authority, which I heard someone say, ooh, right? Mm-hmm. So we understand that we have an issue at mold at our developments, and we're trying our best to address it. We work very closely with Department of Health, mental hygiene. We've updated our recommendations, our practices. We actually started an outside firm to train about 400 of our staff that go to our apartments to investigate mold or excessive moisture complaints. We have hired a vendor to actually start doing apartment inspections so we can identify mold at places where people haven't even called it in yet, or to identify excessive moisture conditions. We're actually moving away from vendor, and now we're actually using our own staff. We've trained our staff to go out and proactively look for the mold in these and try to avoid, again, looking for the root cause, not only just painting over or cleaning what's there, but really finding the root cause and hopefully stop it from reoccurring. Recycling. We have a waste management and recycling group. Housing Authority does not do a good job at recycling. We have prepared recommendations. We actually work closely with the Department of Health to provide educational materials. This year we're going to start rolling out a pretty robust recycling program and training and educational signage, places to hopefully get a sustainable and a true recycling program at the Housing Authority. We work with Million Trees Initiative. We've planted over 12,800 trees on the Housing Authority. We also work with New York Restoration Project and Trees New York to do this. We have actually partnered with residents who kind of want to adopt a tree. And we've allowed them to, Trees New York has provided citizens pruner courses for our residents at a greatly reduced course. And a part of Hurricane Sandy, where we lost thousands of trees, we're starting to work with experts and these organizations to try to identify a tree species that might be more resilient and in case for the next hurricane event. So hopefully it won't be as devastating to our trees as this one was. We also have a pretty robust garden and greening program. It's one of the largest running public gardening programs in the nation. Actually started in 1963. We help about 3,000 of our residents are involved with 672 gardens throughout the Housing Authority, where they grow vegetables and also just ornamental flowering also. We have resident green committees that we work. There's 20 resident green committees where we are trying to promote a healthier lifestyle, more energy efficiency, identify at these developments how we can get them to participate in that. And we also have 2 urban agricultural projects. We have one at Douglas Houses, which is Upper Manhattan, where we've taken an old tennis court and we started to plant. We were actually able to produce about 700 pounds of produce that's harvested at this site. They're able to sell this and create profits from these. And I see I have one of the participants there. And we've also started in Brooklyn in the Red Hook area using added value in the Green City Force again. And there we were able to establish a farm. It's almost about an acre large, and we were able to grow over 4,000 pounds of produce have been grown and harvested at this site. And the last thing I just want to talk about, the procurement of our materials. Our appliances are all Energy Star rated. We try as much as possible to get materials that have recycled content. There's also janitorial supplies. Purchasing green products, we've reinitiated what we call a standards committee to review all of the materials that we use, to the materials that we have our vendors install to install the most sustainable, the longest lasting materials and the healthiest materials. So through these efforts, we're working to provide health, efficient homes, trying to educate residents on best practices and how to avail themselves of resources to ensure adequate health care and promote healthier lifestyles, while employing materials and systems to sustain NYCHA and our environment in the future. We have a lot more to do. And we have, of course, as Ms. Brewer mentioned, we do have funding issues. Some of them we can overcome, some of them we can't. So I'm glad to get the opportunity to get some feedback and hopefully get some other partners that we can figure out ways to solve some of the problems and really affect this large population of New York City citizens.
Thank you very much. Thank you. Our next speaker is Mara Blitzer, who is the Senior Policy Analyst at Housing and Urban Development. Thank you very much for being here.
Thank you very much. I am new to WEAC. I met Onganaya at last year at the U.S. Green Building Council Green Build Conference, which was held in Philadelphia, and we met and she started telling me a little bit about what you all do, and immediately I was a fan and wanted to figure out some way that I could plug in, and then when the invitation came to speak, I thought how lucky I am to be here, and I have all my synapses are firing all over the place, listening to the conversation that you all have had today. The topic that I was asked to talk about is an introduction to HUD and the intersection of housing and health in the work that we do. And I didn't even know where to start.
Do you have any money?
I'll get to that. Yeah, actually, that's a great lead-in. So not really sure where to start, but let me start with a couple of things. First, our mission, just so we all know where we're starting from. HUD's mission, pretty simple: create a strong, sustainable, inclusive communities of quality, affordable homes for all. That is what we are aiming to do. We do that with a budget this past year of about $47 billion. 84% of that budget goes towards renewals. I'll get back to why that's really important in a moment. And we serve about 5.5 million households across the country through our public housing authorities, through tenant-based vouchers, through multifamily housing. Our division does project-based rental assistance, and then we have some specialized project-based rental assistance programs for older Americans and for folks who are disabled. So 84% of our budget is going to rental contract renewals, which means we have about 16% of our budget that is considered discretionary, and every 1% increase in our renewal budget results in a 5% decrease in all of our discretionary spending. That's important in today's federal budget context, and it's important to know that our budget is exclusively discretionary spending on the part of Congress. Unlike Health and Human Services, and I want to respond to one of the earlier conversations, their budget is mandatory spending, and the housing budget is discretionary spending, and that has a really big impact when you get down to the community level like we're talking about here today. But what we can do, we have to start thinking about actually what the budget process at the federal level looks like. So when you're thinking about how to advocate, really understanding some of the challenges in the way that our budget office actually works. So we do a fair amount of work in the energy efficiency realm. I want to talk about two things related to that. One is the Better Buildings Challenge. It's a federal initiative that was started by the Department of Energy in 2010, but was expanded to multifamily residential housing at the end of 2011, and partners in the Better Buildings Challenge agreed to reduce their energy usage by 20% over a 10-year period. And our partners are housing authorities all across the country, multifamily owners across the country. We have about 82 of them, and they've taken this challenge to voluntarily try and reduce their energy. For them, we can offer some incentives to help them reduce their energy usage, and we're really excited to see what's happening out of that voluntary effort. We also have some code standard requirements, and we experimented with some of the Recovery Act money that HUD received to fund a green retrofit program that funded about 200 properties, and then we were able to study them, which is really important. There's not that much data yet on how successful a lot of the government efforts have been to reduce energy usage, and we were able to provide the data for one of them, and what we saw was an average of 20% reduction in energy usage, including energy, gas, and water, across those 200 projects, which is really exciting, and we think that we can use that research to help us get more money to do more energy efficiency projects. One of the other things, so I mentioned before that 84% of our budgets is renewal. So we're spending a lot of our time thinking about housing preservation and not about housing production. So a couple of notes on housing production. If folks here are thinking about the need for building more, building new, to stem the tide of the loss of units that we see naturally, we need to be looking at some other places besides HUD. Although we are the Department of Housing and Urban Development, it is the Treasury Department that oversees the low-income housing tax credit program, which at this point is the most productive federal program that we have for building low-income housing. And then secondly, I think looking at the Housing Trust Fund, which is an empty fund right now that was created during the capital markets crisis, and to think about how we might get that bucket filled with funding to build those new units. So last point I want to make before getting to questions, because I can't wait to hear what people want to talk about, is what HUD is thinking about helping public housing authorities who have tremendous backlogs of capital repairs. Overall, PHAs across the country have $26 billion of backlog capital repairs, and that is basically an insurmountable amount. And yeah, it's mind-boggling. And you've heard some information about what's happening at NYCHA, which is our biggest housing authority. You are not alone, unfortunately. That financing platform did not do the best job of figuring out what was going to happen to buildings and people over time. And so a couple of years ago, we received authority to enact a rental assistance demonstration project called RAD. Someone was having a fun day when they wrote that one up. So we have this program called RAD. Congress allowed us the capacity to transform 60,000 public housing units across the country from the public housing financial platform onto the project-based rental assistance platform, or to the tenant-based voucher platform. In doing so and making what is essentially a technical fix, what that allows HUD to do and for communities to do is to invite other public and private financial investors to join in helping to preserve and improve those properties. So as they are transitioned from one assistance platform to another, you can bring in low-income housing tax credits, you can bring in grants, you can bring in other kinds of low-cost debt products to those buildings to improve the quality of the units for people. So RAD is really important. I mentioned that we received authority for 60,000 units to be transformed. We received applications for 185,000 units, which represents about 15% of the overall public housing stock across the country. So the demand is tremendously there. We have asked Congress to lift the cap from 60,000 and allow us to transform all 185,000 applications, 185,000 units that we've received in applications. That's pending. We're on a continuing resolution right now, hoping that our friends in Congress will see the smarts of the proposal, and even in these tough times, approve that change, which it's pretty critical, and that's probably the biggest thing coming out of HUD right now to support our housing authorities.
Thank you all very, very much. Congratulations. Cecil, do you want people to just raise their hand?
Just raise your hands and
then
we'll come to
Cecil
you.
will kindly, there's some over there. Looks like
go.
over there.
Go to number 1 over there. Gail. Oh.
Thank you. Appreciate it.
Try and make it a question if you can, not a statement.
Hi, I'm familiar to some of you already. I've been chasing you all around town. I'm now a member of WE ACT. My name is Javier. I live in public housing. And my question is actually for Daniel Kass. Has your department read Intro 385, the asthma bill? And if so, what does your department think about it?
So I suppose you've been talking about the intro over the last couple of days, so the audience knows
Yes,
what
sir.
this is.
Yes.
So, we have read it. I will tell you that the city hasn't taken an official position on it. I think there are conversations going on about what that position will be. So I'm actually just not prepared to make a statement about our position about it. I mean, I will say that there are aspects to the intro bill that dovetail nicely with some of the initiatives that we've been involved with. We recognize that the quality of the indoor environment matters a lot. We know that, but it matters a lot for some people more than others. There are different dimensions of the indoor environment that probably matter more than some. I think there is a tendency to ignore the sort of the most prevalent problems in favor of less prevalent. So I think the science is there to basically focus more on pests, for example, than mold from a respiratory health or health outcome perspective. So I think we're going to have to look at this. This bill fundamentally affects the work of the Housing Preservation Department, and so I think they're going to have to basically sort of figure out what their position is.
Thank you very much.
Do you want to go over here, Cecil, or go back over? Go ahead.
Thank you, all of you. I'm so inspired by all the good work you're doing, Ms. James and Kass and Luis and Mara. Thank you so much. I do have a question in regard to the CUNY-sponsored New York solar map that would enable more buildings in New York City to have solar thermal. And I know you mentioned energy efficiency, and I'm wondering if, even though the expense is greater in the beginning, that eventually it saves money over the long run. So my question is in regard to applying more renewable energy in our housing stock. Thank you.
So part of the President's Climate Action Plan includes a goal to place 100 megawatts of solar, of renewable energy, on federally supported affordable housing. So that's whether it's HUD supported or Treasury supported or USDA. So we have an Office of Economic Resilience that does a lot of work on the Sandy disaster recovery work, but also spends a lot of time thinking about how we can support that Climate Action Plan goal with respect to renewables. So we have done some preliminary work. We do think that we will meet that goal. We're going to be doing actually a research study in the next 6 months, asking owners what they have, because it's not a question that we at HUD actually ask our owners, do you already have it? We know the demand is out there. I think with respect to whether it's solar hot water preheat or whether it's solar photovoltaic is really going to be building specific and utility provider specific with respect to whether the math works on that. At HUD, we're really trying to get out of the way as far as not being a barrier to owners putting solar on their properties. And some of the challenges that we have are with our underlying legal documents and folks who want to make improvements like adding solar to their properties in between capital improvement schedules. So they have a 30-year mortgage, and in the 12th year they want to put on solar, and depending on the legal or financial way that they do that and get the capital to do that, sometimes we can be completely supportive and be out of the way, and sometimes we have to work a little bit harder to get out of the way. We are actually working on nationally to try and scale up a project like we call it desktop analysis. So you could be at your home computer and you could type in your own address and
But I
the
guess
program will-
one of the questions would be, has NYCHA taken advantage, or is it an advantage to be taken of regarding what HUD is offering in terms of solar?
So we, excuse me, we have done efficiencies, as I talked about, the geothermal, which was kind of leading edge. To be honest, and I'm always honest, we have a lot of just maintenance
Yeah, we know.
funding that we need to spend, that we need to get our systems up to par, to consistently and efficiently provide utilities. If we can incorporate some of those, we will work
Okay,
to
and I
HUD.
know that the mayor, to his credit, is talking about solar in a lot of school and other city buildings. So there is an effort here to do that.
But can I just say this, that I had a discussion with Department of Buildings as a former member of the City Council. In Brownstone, Brooklyn, a significant number of my constituents were interested in putting solar panels on their brownstones. Department of Buildings was a challenge. We were able to address a lot of their issues related to safety and fire code. And so a number of constituents are moving forward, but there is a backlog of individuals in Brownstone, Brooklyn, and throughout the city who are interested in putting solar panels on their roofs. I think also we need to educate individuals about the tax credits that are available on the state level. And so we need to do, so I support this solar map that CUNY is moving forward on, but, we talk about, construction, but it's primarily in the commercial area. I'm primarily focusing on the 1, 2, and 3 family homes throughout the city of New York and letting individuals know that they can be energy efficient, but we need to make sure that our tax code recognizes and provides them with some benefits because of the cost at the outset.
Thank you. Over there, thank you.
Okay. Each of you, thank you for being here. Thank you for being on the panel. My name is Jacqueline Michelle Holmes. I didn't see any of you this morning. If you were here, I apologize. You should have been here. Okay? Now, I have 2 questions for 2 different people, but one person left themselves open, and I'm out for the kill now because I'm angry now. Okay, first question is for a public advocate. It's regarding Intro 385. Have you signed on for that yet?
Is that the asthma bill?
Yes.
Yes.
Okay.
That's Rosie Mendez's bill?
Yes.
I've been working very closely with Rosie, and I will be a co-sponsor if I've not signed on before. Again, let me remind you that I started the asthma initiative in the City Council.
Okay. Thank you for that. Now, unfortunately, do not take it personal. But you work for NYCHA. I've been a NYCHA resident for 46 years. You should have been here this morning, but I do have a documentary that you can watch. I also have something I can email to you if you give me your email. Okay, you are going to get it right now. Now, you just said NYCHA takes care of the mold now in a really in-depth way. Bull. I have been fighting for years. I had to go to court, and then again, the mold came back, had a report that it's down to the foundation, even gave that to Gillibrand. Kirsten Gillibrand got in touch with HUD. HUD got in touch with NYCHA because they ignored me. Okay, NYCHA's superintendent knocks on my door, tells me it's gonna take us 4 days, we're gonna rip everything out, the walls, the ceiling, and all. Okay, the day that they come, they send one man, he does 2 hours, and he does the same bull that they did a couple years ago. Rip down all the old paint, plaster up any holes, and that mold that's still there, he throws some bleach on it and paints over it. 2 hours. Where is that a thorough job? Okay? I have been breathing that nonsense in for 21 years, and I have irreparable nerve damage, and they're trying to find out what it is that they can do for me. Now, I don't want to hear the same bull that NYCHA has been pushing down my throat all these years.
When did that
Okay? When I
go
need
up?
to pay my rent, I have to pay it on time or get out. When they need to fix something, all they do is give us double talk. When is this going to stop? When are they going to get it? Number one. Number two, Department of Health helped us when we had a problem through Anna Parks from WEAC. We had a really bad roach problem because we also have mold in our kitchen. NYCHA showed up with an exterminator who said, oh, well, I can only spray the liquid. Can you leave for a couple days and stay with somebody until it dries? No, because I'm asthmatic. No, this is my apartment. He said, well, all I have is these roach baits. If you want to caulk up anything, that's another department. We don't do that. Again, NYCHA. This is my landlord. And by the way, on your list, it should be the #1 slumlord, not landlord. Landlords care about where their tenants are. Slumlords don't care, they just want the money. Okay, now well, actually all 4 of you, I'm not gonna separate you with this. I personally invite you to come to my home. And then we can sit down and talk.
All right.
Now you can give me an answer.
Thank you very much.
So I never take it personal. I grew up in NYCHA. I work for you, right? The subsidies and the rent that you pay my salary. My father worked in NYCHA for 38 years. It bothers me to walk and see the conditions that we have in some of our apartments. The reason, what I started my kind of little speech was with the scale of the housing authority. We have 180,000 apartments. We have almost about 11,000 employees. Are we doing every apartment the way that we have trained our staff to do? No. Are all of our employees show empathy towards the residents? To even not empathy, just doing their job? No. So there are always going to be exceptions. I apologize for your condition. I will absolutely go to your apartment myself and see what's going on, and we'll get to the bottom of it.
Thank you very much.
Yeah. And I will also try to see if that problem there is systematic and if it's affecting more than you. So not only the root cause of the mold and the pest infestation, but also the root cause of the issue in that development where you live, which you haven't told me. I'll meet with you after.
All right. Thank you very much, Mr. Ponce. Go ahead. Thank you. Thank you very much.
Thank you. I have a question about the new public housing units. In the City Council Climate Change Action Platform, there's a proposed bill for net zero energy buildings. So my question is, if that bill passes, will that be applied to the construction of new affordable housing units? And then the second question concerns retrofitting, to follow up from the earlier question about renewable energy. A year ago, the City Council passed a law authorizing the expenditure of $100,000 for geothermal surveys throughout the city. You mentioned one NYCHA unit that has geothermal. Can we have a systematic survey concerning the potential for geothermal with regard to NYCHA buildings? And then in terms of heating systems, the issue is not just efficiency, but also can we have non-fossil fuel-based heating systems, for example, biodiesel, Mitsubishi air pumps? Can we look at that in terms of not only retrofitting, but also new construction? Thank
We
you.
will try to answer all those questions. I don't know who wants to start.
Let's talk about the City Council bill. First of all,
Okay.
as you know, the City Council has limited jurisdiction over public housing. We've just been joined by the former chair of the Public Housing Committee, my very good friend, Councilmember Rosie Mendez. So any legislation that is passed in the City Council is more aspirational than directional. And so with respect to whether or not they could build buildings, NYCHA buildings going forward, consistent with the language that's contained in the bill, again, they're not required.
Anyway, go ahead.
Sure. As far as the geothermal capabilities or outside different types of fueling, I can put you in touch with we have an energy department that does that, and we have the opportunity to use other types of heating sources such as geothermal. As far as the type of fuel, so we have moved to cleaner burning natural gas on just about I think there's only 5 of our developments that still burn number 2 fuel oil. We did in the past burn number 6 and number 4, which didn't burn as efficiently, had much more NOx and nitrous oxides and sulfur oxides. But I can actually put you in touch, and
Okay.
we
All right,
can
thank you.
discuss it.
Okay, thank
Absolutely.
Thank you very much. Go ahead.
Thank you. My name is Susan Spieler. I'm a clinical psychologist in Manhattan, and I also am part of the city's Department of Health and Mental Hygiene Resilience and Emotional, what is it called? The Emotional Support Team, REST.
Everything has an acronym, right?
Right, and it's hard to remember, but so in the capacity of a member of the REST team, I served as a volunteer with the emergency shelter after Hurricane Sandy, where I learned that a couple of things, and I want to ask about them. One is I learned that everybody who was disrupted by climate change or environmental things that requires that they move to a shelter has emotional distress. So the Department of Health and Mental Hygiene mostly talks about the health part. We don't hear that much talk about the mental health part. I know people immediately say, oh, that's expensive, and then they change the subject, but it's true. And the people I met at the shelter were only going to be housed for the weekend because the emergency shelter was a school building. So what happened to those people, both in terms of their housing subsequently and their mental health? I'm going to give one example, and then I'll be quiet. One example was a family that I met before Hurricane Sandy. The single mother lost her job, and the family of 3 was evicted. That resulted in them leaving their borough and going to Manhattan, where they lived in a shelter. That shelter, just a few weeks later, so when they moved, that meant the kids both had to move to a new school after school had just started. Then the shelter that they lived in had to be evacuated because of the storm. So these 2 kids were disrupted twice in a few weeks. And I don't know the story before that, but that's a family I want us all to think about, because I tried to find out what happened to them later, and I don't know. So in terms of the future with our expectation of more incidents of climate change disruptions, what is the situation for shelters now that shelter and maybe many others were lost in that situation? We didn't have enough then. I mean, these people just went there for the weekend. Where are they? Where are all those people that I saw there? I'm very worried about it.
Dan, do you
That's
want
all.
to try to address any portion of that?
Thank
Dan
you.
Kass?
I don't know that I have enough details to really share about sort of what I think we can do in response to that kind of situation. I will say that there has been a newfound recognition, and I'm not going to attest to the adequacy of it, but I will say that there's a newfound recognition on our part, and certainly in the city's overall incident command and emergency planning, that mental health issues, coping, and follow-through and follow-up services are really critical components to this. And so we're a merged department. We have a mental hygiene and a sort of general health department. They're highly mobilized in these emergencies. They have been front and center, for example, in our preparation for Ebola for the same reason, not just for potential families that are affected by Ebola directly, but entire communities that are affected by stigma attached to being West African. And so I agree with you. I'm going to sort of take this back and sort of ask about the specifics of what happens when someone leaves a shelter and the follow-up service is available. But I do know that we're conscious of it. So thank you.
I would like
So connected to that, I just want to say thank you. Well, it's related to what he just said.
We're just running out of time.
Can I talk to you afterward? I'm happy to.
Offline.
Okay.
We're running out of
I'll
time.
come back.
Okay.
I'll come back.
Okay.
Next question. Next question.
Hi there. Dan, this is Matt Trichere. You mentioned in your presentation that we can't do everything with enforcement, but let me just say, as a legal services attorney for many years, it would be a nice start if we actually did some enforcement. And, you know, Tish, you were talking about your list, which now has 6,500 bad landlords. It's great what your office is doing about taking some of those on. My office tries to represent tenants, but your office and my office and all the legal services providers together will never be able to meet that need of dealing with the holes in the enforcement scheme. And we know what happens. They disappear off into a dark hole someplace, and they never get enforced. When HPD brings those fines are never paid unless HPD brings
Matt,
a
what's
case.
your question?
The question is, when can we start changing the dynamic about actually getting HPD's litigation unit and code enforcement to actually start going after landlords and making them pay the penalties for all these code violations, which they don't. They settle it for pennies on the dollar, and they never collect it. Maybe we need an oversight or an audit or something to change that dynamic.
I think we can all agree to that.
So
Go
let me
ahead.
just say this, well, first of all, to the previous question, previous young lady who had a question. Tonight, there are 58,000 families in our shelter system. A third of them are children. And so Gail and I and others in the audience, Councilmember Richards, Councilmember Rosie Mendez, have been advocating for years that mental health services should be provided to to most of these families, primarily children, and particularly children who are victims of violence, domestic violence, and the list goes on and on. That being said, let me answer this question. Of the 5 boroughs, as I mentioned before, Brooklyn has a majority of the buildings on my list, 3,716, most of which are in central Brooklyn, no surprise, Bushwick and Williamsburg. Secondly, I've urged the HPD to bring more 7A proceedings against landlords, which allow the city to take management over these buildings and to ensure and to appoint a court-appointed referee or a receiver to ensure compliance. Third, it's evident from our list of violators that we must move to expand the AEP program, the Alternative Enforcement Program, to include more than 200 buildings. There was a bill that was recently passed in the City Council to increase that number to 250. I believe we should increase it even more. And last but not least, obviously HPD needs more tools in their tool shed to enforce the law with respect to these landlords. You're absolutely right. All of the legal services is in my offices. There's no way that we can address these 6,700 landlords by shaming them alone. But we, in the next few weeks or maybe months, we are looking at the banks behind these landlords. And if we can't get to the landlords, you can certainly assure that we're going to get attention when we expose all of the banks that are funding these slumlords in the city of New York.
Question over there, our last question over there. Oh, there's another one, okay.
I actually have 2 very quick questions, one for the gentleman from NYCHA and one from the lady from HUD. The first question is for HUD. HUD has multiple different standards that they follow depending upon if it's public housing or Section 8 housing. And then they also complicate it with the healthy housing, the principles for healthy housing. Is there any work going on to try to at least update the housing quality standards, which have so many flaws with them? Maybe to incorporate UPCS or the healthy housing standards. Is there anything going on the HUD side to update the housing quality standards? And part 2 is for the gentleman from NYCHA. Is there any discussion or what is the possibility of, instead of utilizing HUD's housing quality standards, which are the federal standards, to instead utilize the permission that's given in HUD regulations to adopt an alternative standard in your administrative plan that's stricter than HQS for your Section 8 portfolio?
So I'm not familiar with any specific effort to tighten up the standards. We're doing a lot of work right now on alignment of the standards, both across all the different parts of HUD that you mentioned, and then we also work a lot with the state housing finance agencies and with municipalities, and so most of the effort has actually been about trying to have same standard rather than changing the standard.
As far as Section 8 programs from HQS standards, I am not aware of any changes to that. We have used that for years, but I'd be happy to talk to you after, and I can put you in touch with the woman who operates our Section 8 program and have that discussion.
Thank you very much.
Thank you. Next.
Hi all. My name is Raylene. I'm the daughter of this lady that you'll never forget. I'm a youth producer. I contacted you, I remember, Letitia James, on behalf of the Educational Video Center. I'm the one who produced the documentary on environmental hazards in public housing. And oftentimes youth, we go unheard. And so today, since it's my chance, I will not be unheard. I will not be pushed off. And I didn't hear from everyone about stopping by to my house. So my question, I guess, would be is, what day are you free to come over?
What are you serving for Thanksgiving?
Come on over, we got plenty, all right? Plenty of everything.
Something tells me you can cook.
That's everyone, yeah, uh-huh. All right, Mom, no.
Come on, baby.
Well, all right.
I want to hear from everyone, I really do, because this is an ongoing issue, and all I know is a moldy bathroom. I was born into it. I don't. That's not healthy. So I really want to hear from everyone. What?
Well, Mr. Ponce said he was going to come visit. Do you have a date that you might visit, and then we can all join if we want?
As soon as this is over, I'll put you in my car and we'll go to your house. I have no problem doing
Let's
that. Let's
go.
You guys
Yeah.
live together?
Yeah.
Is it one visit
Yeah.
or two? Okay, great. I can help you prepare the turkey, maybe.
I'm waiting
Anybody
until
else?
I'm waiting until after the turkey's done.
All right, that's
You'll probably
fine.
see me Friday.
That's fine.
All right, so that's a good answer. We appreciate that.
Are you coming?
I can't come today, but I'll come with
You don't have
Tish.
to come today. It's all right.
Tish and I will come right after turkey.
There we go.
All right, that's fine. That's fine.
We'll have
Thank
the
you.
leftovers.
Hopefully we could fix a few things before you guys
There
stop
you
in.
go. There you go.
Thank you very much.
Hello, everybody. Mr. Ponce, I believe we've worked in the past. My name is Anna Parks. Dan, it's good to see you. Well, as you've heard, I've been working with this family for some time, and you guys wasn't here during. This is one of my difficultest families I've worked with because there's not really a success at the end. I'm hoping after this we'll get some answers. I have a question for Mr. Ponce. Mr. Ponce says, in the past I've worked with families that have had asthma, and I've been able to obtain a 504 form through NYCHA to be able to take to the medical doctors, and they can fill it out, and at that point maybe submit it to NYCHA and maybe be able to either get a transfer or get the repairs fixed in the apartment. Does this still exist? Because I've been looking for it and I can't seem to find it.
It's online. There is no requirement for you to fill out the form. You can walk into any of our management offices. They will assist in filling out the form, or at least getting the information that's needed, and we can start the process pretty much immediately. Don't stop waiting for the form. Just stop into the management office, or I can even put you in touch with someone in our central office who can get the process started also.
I would like to speak to you later,
Sure.
but the other question is...
Anna,
Sorry.
so I've broken my rule, which
Okay.
is
We'll talk later.
We'll get to that other question. These are really the last two, and you have to ask questions. You have to get to the question. No walking up, no crawling up. Get to the question. Ask them. Let's go. And you too.
Me first?
Yes, go.
Okay, question is, NYCHA policy is that for emergency transfers, you have to request. HUD regulation is if you have conditions that are detrimental to health, NYCHA must give you the transfer. You don't have to ask for it. There's a conflict there. Which one is the right one? HUD regulation says NYCHA is required to live up to the obligation to the lease and make the repair, or move the tenant if the repair can't be made within 24 hours. NYCHA, I went to your site, it says you have to make the request for emergency transfer, and you must be in good standing with NYCHA, and all payments must be made before you can get an emergency transfer.
That's
That's a conflict.
That's a good answer.
That's it.
If your apartment is uninhabitable or has an unsafe condition, we will either temporarily remove you while we do the repair,
Didn't happen.
or we will
Didn't
have
happen.
you. I'm sorry.
Did not happen. I was
Okay.
featured on Dateline. They made the repairs, tore my walls down while my family was still there. We breathed dust, the mold, everything else while we were still living there. Did not happen.
Okay, so then we could talk and see what
You're a
it is.
good man.
Do you still need an emergency
First
transfer?
of all, you're a good man, and I appreciate you taking the hot seat for
Okay.
Cecil.
Next
Thank you.
question.
No,
We're
good.
going to
Thank
move
you.
to the next
Thank you.
question.
Thank you.
Hi, I'll just ask a quick question. Mental health was brought up as an issue. I'm a student at Mailman School of Public Health, Columbia. If students and practitioners want to get involved with mental health and help out, how do we do that?
Well,
So you can always contact my office, 212-669-7200. Chris is standing right there over to get his card, and you can work with our office. We've got a load of volunteers and interns that do a lot of research projects for our office.
I just want to add that I think in general where the focus should be is on the schools, and you could work with Department of Health, maybe Dr. Platt, and finding out ways that the schools need quality, culturally appropriate mental health in ways that anybody cannot imagine. The issue is we could deal with some of these affordable / environmental issues with the families if we knew about them in advance. So I would suggest working with the public advocate, but also with Dr. Platt at Department of Health. Up to you, Dan.
I think that makes a lot of sense. I mean, if you want to give me your name afterward, I can forward it to the folks. You know, there's a vast array of mental health service providers across the city that work in a large number of domains, whether adults, children, whether substance abuse, chronic mental illness, acute mental illness. So there are a whole host of ways in which you can engage in the mental health system as a student, and I'll try to find somebody who can help you.
Please work in the schools. That's my beg.
Let me just say that I hope all of you join with me as the Office of Public Advocate announces an initiative, hopefully funded by the City Council, to restore the health clinics in our schools. As most of you know, Mayor Bloomberg removed a significant number of clinics in our schools. And what we are going to do, my office, is try to get funding from the City Council to restore all of them, with an array of services.
Okay. Let's thank our panel tremendously, and thank WEOC for putting it together. Thank you very much.
Picture for you guys take a picture. Listen, despite some of the challenges we have with elected leaders, the borough president, Gail Brewer, our public advocate, Tish James, these are outstanding public servants. They've dedicated their lives, and I know when they say something, we can count on them. So we heard that the public advocate is with us on Intro 385. We heard that the borough president is committed to going out to seeing what the problems are in public housing with some of our members, and we really, really appreciate that. We also heard that Mr. Ponce, who I don't know as well, is really here to go out as well and see what's going on the ground firsthand with some of the public housing challenges that we described. And Dan Kass, as always, thank you so, so very much.